Okay, I'd like to extend a warm welcome to everyone joining us today. My name is Sandra Sujin Lee, and I'm the Chief of the Division of Ethics and Professor of Medical Humanities and Ethics here at Columbia University. It's really wonderful to see so many of you today at our first event in 2024 of our Bioethics in Film from Screen to Seminar series. Through Bioethics in Film, we aim to convene a broad audience around films, documentaries, and television to explore critical ethical and social issues and questions that impact biomedical research and health. I'm especially excited by how many different specialties, disciplines, and fields of study represented by our audience members today. Leveraging multidisciplinarity and our collective expertise and experience helps us understand and navigate bioethical challenges, and specifically the complex nature of our subject matter today. The film we have chosen for today's discussion is My Sister Liv. The film features sisters Tess and Liv, who from a young age are inseparable. Liv is a young girl growing up with relentless pressures of social media, teen depression, and often suicidal thoughts. My Sister Liv takes us into a rare and riveting journey of raw emotions and fears of a young life on the edge, and ultimately a big sister's desperate struggle to save her. Through fearless storytelling, My Sister Liv reveals the realities of stigma, the struggles of mental health, and the aftermath for the survivors left behind in a suicide. This film shows that as a family learns to cope with their new normal, they find hope in filling a gap around fearlessly talking about mental health and ultimately to save young lives. We are extremely fortunate to have wonderful panelists today. Honey Beuf, Dr. Randy Auerbach, and our moderator, Dr. George Hardart. In today's program, our moderator will provide brief opening remarks followed by moderated discussion. And we warmly welcome our attendees to join in this discussion by sharing your questions in the Q&A box and any comments or observations in the chat box. Before I introduce our moderator, I want to go over a few housekeeping items. We ask that all attendees please abide by the code of conduct, and a link can be found in the chat. We have a live closed captioner present for this event. So if you wish to use closed captioning, please turn on the CC button at the bottom of your screen. We will reserve the last half hour of this event for audience discussion. So please use your Q&A button, which you will find at the bottom of your screen, to write in questions for the panelists at any point during this session, and we'll make sure that we try to get to each and every one of them. You can register your enthusiasm for a question and elevate it up the list by using the upvote button in the Q&A box. The chat box is also available for further engagement, and we will post any relevant links to resources referenced in today's discussion there. So you will have that, as well as a portion of today's presentations that will be available on our website following the session. If you have any logistical questions or troubleshooting needs, please email us at the email address in the chat at any time. Now, before we start the screening of My Sister Liv, it is my absolute pleasure to introduce the moderator of today's discussion, Dr. George Hardart. Dr. Hardart is Professor of Pediatrics here at Columbia University in the Vagelos College of Physicians and Surgeons. He is Vice Chair for Hospital Affairs in the Columbia University Department of Pediatrics, and a physician whose practice is focused on pediatric cardiac critical care in the Morgan Stanley Children's Hospital. Dr. Hardart is the founder and director of the program in Women and Children's Bioethics at Columbia University and director of pediatric ethics at the Columbia University Irving Medical Center. He serves on the adult and pediatric ethics committees and is a pediatric ethics consultant at CUMC. Dr. Hardart conducts both theoretical and empirical research on a range of ethical issues, including family interests and medical decision-making, end-of-life care, and determination of death. Now, we're going to begin with the screening of the film, but before we do, please be aware that the film contains topics such as depression, self-harm, disordered eating, sexual assault, and suicide. So we ask that you please take care while you are watching. And with that, we will start the film.
We'll start the next phase of our program now. For those of you who might have missed the very beginning, my name is George Hardart. I'm the moderator of this event. First of all, I would just like to thank Honey and Tess for bringing this very powerful film and event and opportunity to us all here at Columbia, and for all they're doing to actively and courageously address this mental health crisis we face today. It's very hard act to follow to say any remarks after that film, but I'll just begin by a few remarks. Liv's loss is hard to accept, understand, explain. Such a wonderful life that was derailed somehow. It demands we look for reasons and meaning. Was it preventable? What forces in society on the micro level, macro level played a role? What is our obligation as a society, as a healthcare community to respond? And if we respond, how do we act to make the most powerful difference? Personally, I'm an ethicist. I am not a mental health expert. But like all of us, it's hard not to recognize this is a time of crisis in our society. And harmful crises demand action. But how should we act? The question of how we should act raises some of the most challenging ethical questions we face in this arena. And it actually reminds me of a very fitting allegory I'll share with you from a very wise mentor of mine many years ago. It's a pretty simple story of two people standing at a riverbank who see first one person and then several struggling as they move down the river. So these people on the riverbank jump into the water and they rescue one person. And then they rescue another as they see more coming down the river. But eventually they just can't keep up. They're trying their best. And suddenly one of the two people gets out of the water and starts to run upriver along the riverbank. The other rescuer yells at them, "Where are you going? These people need us." And the response was, "I'm going upriver to find out who's pushing all these people in the water." So like those rescuers, we have a duty to act to save innocent victims. But what should we do? Should we gather all the resources we can muster to jump in and pull them out the swimmers? What if we can't keep up? Or should we go upriver, find out why it's happening, and stop it there? I think it's a particularly pertinent question for us at a research university like Columbia. Of course, should we do both? We should try to do both. But how should we allocate our resources? Are we doing enough at the riverbank? Certainly, the Live Project certainly is. Are we doing enough upriver to answer the scientific questions and then act as a society to mitigate the causes? The numbers cited at the end of the film are just staggering. 48,000 suicide deaths each year, and the second leading cause of death among young people. Those facts demand action. Our children are growing up in a hurricane, and we have a duty to try to save them. Gratefully, this afternoon, we have two extraordinary panelists who can help us, hopefully, to find some understanding and context, maybe even a few answers. So it's going to be my pleasure now to introduce them. So first, you've all really met Honey Beuf. Honey is the co-founder and executive director of the Live Project, the nonprofit that develops creative tools encouraging fearless conversations to turn the tide of youth suicide. Following Liv's death at age 19, Honey and Liv's sister Tess, as you know, collaborated with an Academy Award-winning film to create this remarkable documentary. Honey has a BA in sociology from UPenn, and Honey is determined to using her creativity and the business acumen she honed as CFO owner of a Colorado staffing firm to eliminate the shame and stigma attached to mental illness. Second is Dr. Randy Auerbach. Randy is a tenured professor in the Department of Psychiatry at Columbia, and his research is committed to improving our understanding of depression and suicide in adolescents. To date, this work has resulted in over 200 published papers, and he's received a number of awards, including the Joel Elks Research Award, the David Shechow Early Career Award, the Richard Avedon Early Career Award, and the Theodore Blau Early Career Award. So I want to welcome our two panelists. We'll start off with some prepared remarks and then enter the Q&A session. So Honey, would you like to go first?
Sure. Thank you so much, George. I'm truly grateful to be here with you all today. I'm not a mental health expert, but I have learned a tremendous amount since Liv's death. Academics and the curiosity about how ethical and social issues impact healthcare, and in this case, mental health, it's in my genes. My father was a pediatrician and my mother a professor of sociology and medical ethics. So the invitation to present my story at this esteemed institution truly is an honor. You just saw a glimpse into Liv's many extraordinary characteristics. Her greatest attribute was her compassionate heart. While she struggled with her own deeply profound emotions, she put the health and well-being of anyone in need ahead of her own. She was struck by the disparity of care and services available to other struggling young people, both in our community and around the country. She was very aware of how fortunate she was to have a loving family and the means to have access to mental health professionals and hospitals. She wanted to be a part of change that would ensure that the current barriers to care no longer existed for others. Knowing that she wanted to change her major from early childhood education to become a therapist had filled my heart, and I was devastated that she never got to realize that dream. So now it's my mission to carry out her legacy of caring and kindness and strive to make our resources available to anyone who needs them and to partner with like-minded organizations. As a society, it's imperative that we work to make mental health care equitable, accessible, and compassionate. Ethically, I believe that mental health should be under the same umbrella as physical health. We should be treating mental illness with the same humanity and support as we do with cancer, heart disease, or a broken bone. There need to be more mental health professionals in hospitals. As I continue this work, I hear from parents struggling to get an appointment, waiting months for an opportunity with a therapist for a child who is deeply in crisis. The available hospitals and beds are sorely lacking. And I struggle when I think of how many lives have likely been lost as a result. I believe that collaboration and community is how we can support one another to facilitate change. My work with the Live Project is to bring programming, tools, and resources to anyone who wants them so that we can generate fearless conversations about youth mental health and suicide prevention. Community and connection are key to this process. The more we work together, the more likely it is that we can see a change in our current crisis and eliminate the stigma and shame associated with mental illness. Please be compassionate and empathetic with yourself as you would be to others. Talk openly about your mental health and be a connector for someone who's struggling. talking about suicide reduces the risk of someone taking their life. That is a fact. As George said, for more information about our project and access to our life-saving discussion guides and tools, please check out our website at theliveproject.org. You can subscribe to our newsletter and our social media. And I would really appreciate it if you could take a couple of minutes to fill out our brief anonymous survey by using the QR code that was provided in the chat. Lastly, I want to thank the Film Organizing Committee for inviting me to share my story with you. This can be a difficult topic to highlight, and I commend them for their bravery and commitment to provide fearless content to elevate the conversations about the current youth mental health crisis. And to you, wonderful audience members, thank you for your curiosity, your time, and your desire to learn more. I applaud each and every one of you, and I look forward to hearing and responding to your questions. And now it's my honor and pleasure to turn the mic over to Dr. Randy Auerbach.
Thank you. So I just want to first start by just saying thank you to you, honey, to Tessie, and your family and friends for giving us this gift. This film is powerful and it's important.
Thank you.
I know that I was brought in here to be the expert, but I'm left with four troubling questions that I think underscore the importance of the work that you've created. And so when I look at, this is the second time I've had the opportunity to view this film, and so it's really allowed me to kind of think deeply about your daughter from this developmental perspective. The first question that I grapple with is, how do we prevent suicide? When thinking about your daughter and her beautiful life, her story echoes a lot of the stories that I've heard in the work that we do at Columbia and within our community. There was challenges early on with her struggles with anxiety. She then spiraled into depression, which contributed in part to issues around eating, her bulimia. And what is not uncommon is this for them to spiral into issues around substance use, which may have contributed in part to this unwanted sexual violence. And she got caught, I think as George said it best, this hurricane that, every time that she kind of felt safe for these brief periods of time, she was swept away in just the tumult of her life. And you could see that when we think about suicide prevention, we often have this vision of thinking about it from this acute perspective. There's a window of time where we need to intervene to help, and it's at crisis. And there was one young man in a Zoom session who actually said it really well. In our country, we focus on mental health from a reactive perspective versus a proactive perspective. And we need to really start early on to avoid getting to the point where there is this chaotic acuity where suicide is coming into play. The second question that I'm grappling with is how do we improve clinical effectiveness? As we discussed earlier on, honey, it would seem that your family had done everything conceivably possible, brought her to the best of clinicians, got her wraparound care, several stints in inpatient care, followed by outpatient care. And by all accounts, if there was anyone who could have overcome what she experienced, it'd be this use case. And I think the sad truth, what it underscores for me, is that families and friends can at times do almost everything right. And we still have these really profoundly unfortunate outcomes. And for me, as both a clinician and as a researcher, I don't really have good answers as to why that is the case. The third question is, how do we create a better safety net? Here again, what this film documented to me was the tireless vigilance of you and your family, of your daughter, of her friends who seemed amazing. who really showered her with love across the different extracurriculars she engaged in, whether it be musical theater or music in general, or even cheerleading for a stint. And here again, one of the things that we know from the literature is that when there is a severing of this community, that's when somebody is most at risk. And what it makes me think about is this transitional phase when people leave the home to go to university, where adolescents overnight become adults and their healthcare, particularly mental health care, becomes extracted and excluded from their guardians, and the challenges it creates. Now, I'm not a lawyer, and I know that there's legal issues that are important, but it does create a challenge. It's something that we experience here at Columbia, where we want to provide a safety net for our students, and at the same time have to respect their autonomy when they've reached the age of majority, and the challenge it's creating and the gap in the clinical care, which often needlessly, in my view, can result in greater acuity of psychiatric disorders and at times higher risk for suicide. And I think the last question I'll leave you with, which again, you'll have to forgive me for all of these because I don't have particularly good answers for any of them, is that how are we helping youth in crisis? I think that it is laudable and appropriate, for your organization and others to come up with strategies. But here again, we're leaving it to youth to find these things, to search online when they're experiencing some degree of tumult, distress, and we're not effectively arming them in a proactive way. We kind of joked in our prior call about how there's so, in terms of sex education in this country, we do a remarkably poor job. But as remarkably poor of a job that we're doing in providing education about sex in our school systems, we're actually providing less information on mental health, despite the fact that it'd be a far cry to find somebody in any school setting which hadn't been touched by some degree of mental health, whether it be through friends, family, guardians, or even teachers themselves. And so we're doing ourselves no service because we're not really arming people. We're arming them once they're already in the battle. And again, being proactive means helping individuals understand the early warning signs of what is psychiatric illness, how it may affect them, what they could do when they're experiencing it as a child in terms of their parents' experience of it, as a friend, who could they turn to? Because it's a tremendous amount of stress and burden that we're placing on our youth to just sit on this without the resources to handle it. Then, of course, as was noted well in the film, is that there's innumerable exposures in person, whether it be bullying, ostracization of some sort, or even on social media. And while social media can provide some degree of resources, particularly to marginalized and minoritized youth, in terms of providing some degree of an olive branch to a community that they don't have in person, there are unfortunate exposures in terms of hate speech and discrimination and body shaming and things of that nature that create irrevocable harm, particularly during this profoundly important developmental phase. And so here again, there's an opportunity, I would say, for us to do better, to reach out to youth in need and provide preventative care versus reactive care. So I will stop there with my questions, but they also are innumerable, but hopefully that provides some talking points that we could address together today.
Honey, I have a follow-up question or two for you, but I'd love just to open it up to you to respond to anything that you might want to in Randy's comments.
Yeah, I mean, Randy, you brought up so many great questions. I don't know that my brain can process all of them at the same time, but you're hitting on such an important topic in that we as a society react proactively or reactively, and we need to be acting proactively. And that's why, the work that we're doing in bringing this film to people, in working in partnership with any organization, specifically here in this country, but we'd love to go global. But working on finding ways to get this messaging out to young people. And it's not just the young people, it's also to the people who care about them and love them. Because I think one of the fundamental gaps that we have is that our caregivers, parents, grandparents, people, teachers, counselors, people who love our children are too frightened to have these conversations, these necessary conversations, to delve into the questions about our mental health, our emotions. And one of the points that you brought up in your questions is that, or a statement you made is, we shouldn't be having these conversations when a crisis occurs. These conversations should be started when our kids are young, when they're little, talking with them, not about, hey, how was school today? How'd you do on that math test? But asking them, how are you feeling today? What kind of emotions are you having? Of course, age appropriate questions, but teaching our children and modeling for them that it's really important to be addressing what's going on for us emotionally, and then modeling for them how we deal with those stressors. I mean, and again, I can, like we talked about in a couple of our conversations earlier, I could go on for hours talking about what's wrong right now and what we can do. But we need to arm our kids. We need to fill their toolboxes long before they even get to college, but start working on filling those toolboxes. And another point I bring up in a lot of my conversations with our audience members is, as parents, I mean, we innately feel that we need to be the problem solvers to, immediately fix whatever issue is going on with our kids, right? They're having troubles at school. We need to fix that. Problems with peers, with bullying, we go into problem solving mode. And I think, and this is something I wish I had known when Liv was alive, because I did that. I thought that was what a parent should do. What I now know, and what you all saw in the film, is it's vitally important for us to develop our listening skills and to allow our children the opportunity to be vulnerable with us and to talk to us about what's going on for them, and to let them know that there is nothing too frightening for you to hear. Because what we hear all the time from young people is, I didn't want to burden my parents. I didn't want to scare them. So that's why I didn't share that I was struggling. So I just really want to emphasize that to parents, caregivers, teachers. Be good listeners. Allow your children to talk, and that will show them that you don't have the fear. And something else, I feel like I'm going to ramble forever, but something else is letting your child, your friend, anyone who's struggling know that they are not the only ones experiencing these feelings and thoughts, that each and every one of us as human beings experiences a mental health crisis of some sort. And by allowing them to know that that's the case, hopefully they will be more open about talking about what's going on for them. Sorry, that was a long ramble to try to address these questions.
There's a lot of wisdom there, honey.
Thank you.
Hey, honey, a couple of easy ones for you, and one question that's come up in the chat so far. How can other people view this film?
That's a great question. Right now, we do not have a distributor for the film, so it's not available publicly. So what we can do, you can go to our website. We have a form you can fill out if you would like to bring the film to your community, and then we can talk about how we can bring the film to you.
Great,
We,
thank you.
you know, my pipe dream is I would love to see this film available to absolutely anyone who wants to watch it. But right now, we're not in the position to do that.
And the game, I bet a number of our viewers are interested in. Tell us more about the game and how people could access that, and maybe it's on your website, but please tell us about it.
Yeah, thank you for asking. I have it right here next to me, the game that goes there. These are illustrations of the monsters that we all have in our brains, in our minds. The game was co-created with an organization called Humanot out of Tennessee, and the experts at Children's Hospital in Colorado, at the Pediatric Mental Health Institute, a number of friends and kids and mental health experts helped to create the game prompts that are in the game. There are 2 rules for the game. First, be honest and don't be a jerk. And the second rule is you only have to go there if you want to. And there are 3 levels of prompt cards. There's the kind of going there, which starts with really soft, funny questions, easygoing. Then there's the almost going there cards, mid-level, and then the we're going there card. And that's when you start to get really deep. And it is, you asked where they could get it. It is available on our website. You can order the game. I also want to let mental health experts out there know that as a nonprofit, I like to donate this game to people to use in their clinical surroundings. We have a number of therapists who use this game in therapeutic sessions. We have a couple of hospitals who are using it in both their inpatient and outpatient settings. And the last thing I would say is this game is magical in the way that it prompts people to open up about their deep feelings. And they come to realize when they're playing it, again, they're not the only ones who have these monsters in their heads. And then they can start engaging in a conversation about how it makes them feel. And people start connecting and talking with one another. So we kind of liken it to a cross between Cards Against Humanity and therapy. So it's really fun.
I have a question really for both of you, but maybe you could start with you, Randy. It obviously came up in Liv's experience, the going off to college, and you've referred to it a little bit. But what might you say to parents whose kids are going off to college? What kind of tools or advice could you give them to prepare them for these things?
Yeah, that's a great question. So, part of my work is working with colleges around the US, but also internationally. And what we found is that about 1/3 of students transitioning to college in their first year have reported a psychiatric problem in the year prior to going to college. So this is the period of their life where should be kind of the absolute best period of their life, kind of taking this next step, advancing to kind of this new, at least within the US, typically changing your housing situation. But they also often take this opportunity to detach from their existing treatment, meaning it's a time where they'll go off medication. There's times where they're going to say, well, I'm living in new city X and I was in city Y, and so I'm basically going to stop therapy altogether. What we know is that stressful life circumstances confer greater risk for experiencing emotional distress. And so what I would encourage families to consider is, making mental health a priority in this transition. So, I think what is typical when we're looking at universities around the country, whether it be urban, rural, or anywhere in between, is we're focusing on the type of classes that they have, the type of extracurriculars that they may engage in. But given the prominence of mental health, I would ask, what are the resources available for students? How are students equipped during periods of acute crisis? So, in our university setting, we know that the need for resources is like a wave. At the beginning, nobody needs it. By mid-semester, when midterms set in, there tends to percolate up, and by the end of the semester, there's a waiting list for 8 to 12 weeks. And so, what are institutions doing to manage this is one thing. The second thing is, I would encourage families not to detach from their treatment plan. I think that it is the absolute worst time to go off medication and change treatment. You're being thrust into a totally new social setting, social dynamics, different challenges from being away from home, different changes to your sleep schedule, exposure to alcohol, exposure to unwanted sexual contact, and many, many things of the like that we know are known contributors to mental health challenges. And then the third thing I would say is, have it as an open and everyday conversation, with your child. How are you doing? What are early warning signs that I would know being 1,500 miles away, 500 miles away, 50 miles away, 5 miles away, that I would know what is changing in your life? Are there things that you want to tell me now that I should check in with you about? How can we make sure that you're feeling supported in the way that you deserve and need during this really profound period of transition?
Yeah,
I-
I agree with
Oh.
everything you're saying there, Randy. Absolutely. And back to the fact that if kids are waiting for an extended period of time to get into the services available at school, what I recommend is keeping the medical team that the child had before they went to school. You can do therapy sessions online now. So keeping the therapist who your child has worked with leading up to going to school is something. Also letting your child know that even though they're 5 minutes away, an hour away across the country, you are available for them 24/7. They are your priority. You love them. And no matter what time of day it is or night, because a lot of their crises seem to happen in the middle of the night, that you will be there and available to them. And the other thing I would say too is that there are resources. There was the QR code at the end of the film internationally for how you can find crisis support numbers. And what I am telling parents now, which I didn't know when Liv was at school, never even occurred to me, but crisis text line here in the US is a great tool for young people because young people like to text. Crisis text line is available 24/7. It's free. It's compassionate, caring counselors, and it is anonymous. And I would tell any parent to have their child program in crisis text lines number. They serve both English speaking and Spanish speaking people, and 988 here in the States for immediate help. So again, it's loading that toolbox before your child goes away to school. One more point is, I think it's really important to talk with your child about establishing safe relationships and connections at school, like the minute they get there, finding who they can talk to openly and honestly about their feelings, preferably a reciprocal relationship, so that they identify who they can go to immediately as soon as a crisis occurs.
That's tremendous. Just following up on those wonderful comments by both of you, and coming into the chat, I think they're sort of pleas and questions about what universities can do better. What are they? I think you both referred to maybe their resources are a little lacking, especially at crisis times. But it's very much on people's minds what they might be able to do better.
I think it's a great question. I will say, I think that it's easy to, it's tempting maybe to diminish the efforts that universities and colleges are making to address mental health. I think what they are facing is a tidal way of mental health crises. by the time college students are arriving on campus, they are more acute, in part because many of the issues that Honey alluded to, that it's extremely difficult to get treatment. They're living in high pressure environments to exceed, to excel, to drive towards whatever their goals are. And they're also being exposed to more at rapid speed than any other generation before. And so I think that a lot of institutions do have tremendous resources in place. Our data would suggest that upwards of 80% of individuals who self-identify as needing mental health resources actually don't seek out mental health care on campuses or within their community. And so part of the challenge that we're facing in terms of managing mental health care among students is that they're actually not seeking out traditional lines of clinical care. One, I think, really nice offshoot that has emerged across many, many campuses, if not all campuses, are peer support programs. I think peer support programs provide an excellent opportunity for students to feel connected. I think that this is particularly true of minoritized youth who are less likely to seek services on campus, or marginalized youth who are less likely to seek services on campus. What we could do better, I think, is provide resources to these peer support programs to help them understand how and when to triage these cases and create safe fora for them to connect to clinical resources when they are more acute, whether it be on campus or within their communities.
Yeah.
One thing that came up so much in the film, and I think I'd love to get your thoughts on it, is social media. And you both refer to them to a certain extent. But I think in the film, Tess seems to draw a connection between social media and the acceleration of Liv's challenges. And then we know this, and we've talked about it here, the tidal wave. I wonder how much you would ascribe social media to the tidal wave, how we might sort that out, and how we might respond to it.
Okay, I'll take that one for now. Yeah, social media is huge. I mean, and as Randy said, it can be good for some reasons, and it can be very toxic for others. We at the Live Project we refer to it as the compare and despair mechanism for young people as they get caught up in comparing themselves and then feeling absolutely awful about themselves because they can't be as perfect as the people that they see. And of course, we as adults know that those are all fabricated, they're doctored, people only post the very best of themselves. What I would recommend, again, I'm not going to tear down social media, but I always recommend to parents to talk to their kids about recognizing how they are feeling when they're scrolling. If there are people or organizations that they're following that make them feel kind of icky about themselves, it might be a good time to unfollow those people. Again, really paying attention to how is it affecting me when I am looking at these sources. But yeah, I mean, it can be very scary. Randy, I'm sure you have some.
No, I a lot of what you said definitely resonates. I think for me, I think that this is just the reality that we live in right now. And, I'm kind of beating the same drum over and over again, but, it starts with how are we approaching this from a preventative perspective? We're not going to shut down social media sites. I don't think any of us have that capacity. Maybe at least the three of us, maybe other people on this call do. And what I liken to is when I was growing up, we called it the phone in the kitchen, meaning, when I was growing up, whenever I talked to a friend, there was just people around me at all times. But now we have youth who have these supercomputers in their pocket who are accessing the far reaches of our earth, just by being online. And so what strategies are we teaching parents in terms of how to monitor, to be vigilant? How are we proactively working with teens in order to help them understand the dangers and really partner in this process to try to figure out, common sense solutions that actually may help us manage some of the associated distress that they experience?
That's great. We are coming close to our time. If Sandra's available, I would invite Sandra to come on. I know she's been monitoring the chat and might want to bring forward a question or two before we wrap things up. But I want to thank both of you for your remarks. And honey, this is just a remarkable film that you and Tessa created, and very appreciative of it.
Thank you.
I want to second, third that, really a tremendous gift. We do have just a few minutes, and there's some wonderful comments, really rich discussion happening in the Q&A box. One question that I have for actually all three of you is really thinking about, why is this topic an important ethics question? And honey, I was really struck by your personal background in terms of your family. You had mentioned that was it your father who was involved in ethics and thinking about ethical questions, and just in terms of the ethics of care, how should we be centering this as an ethics question and an ethical imperative? I mean, given that we know that there are it seems almost as if there is an epidemic of loneliness and depression, and how can we galvanize from where we are institutionally and otherwise, really putting a spotlight on these questions, and frankly the crisis, as an ethical responsibility to address. I know it's a big question, but any of your thoughts would be so helpful.
Me or Randy or George?
You could start with George. George, I'm turning the
Yeah.
you
Yeah.
into panelists.
Well, I think it's why I refer to it as a hurricane, and why I told that story is that, I just think there is a moral duty that we have as a society and leaders within this society, which we all have that, we have that label, to act. It is, the analogy to a hurricane is, if you live in Florida and a hurricane comes and devastates your town, you can't go, wow, that's so surprising that happened. What could we have done? You can't say that, because hurricanes happen in Florida. So you have a duty to plan and act to prevent harm. We're living in a slow-moving hurricane, and I think it's just stating the obvious that we have a really profound duty as a society to not just put our hands up and jump one by one in and save people as they come down, but try to address it at the source if there's a way to do it.
Great. Any other comments before we wrap up?
Yeah, I was just going to say thank you for saying that, George. I mean, we all need to be working together. This is a collective problem. This is affecting all of our children, right? Some of them, you're not even aware that they're struggling, but we need to come together as a force. We need to be lobbying to get more support and to make care accessible to everyone, especially marginalized populations. But yeah, I mean, at the Live Project, again, we are constantly talking about the necessity to be having these difficult conversations and doing what we can to stamp out the stigma and shame that surrounds mental illness.
Thank you. Well, good. So I think we are at the end of the session. I think, there's so many questions and thoughts in the chat, and we're going to make sure that we find ways to address some of the questions that are in the Q&A box. One question was whether or not this session was being recorded, and it certainly was, and it will be at least parts of this this session, in terms of the discussion, will be on our Division of Ethics website. So look for that. But I just want to thank our incredible panelists and moderator today for the presentations and the discussion. I also want to thank our Bioethics and Film Organizing Committee for their support in planning this year's series. And I want to thank our audience for your thoughtful questions and engagement through the Q&A. We want to invite you to register for our next Division of Ethics event, which will happen on February 13th. This is part of our Ethics Grand Round series, in which we'll have a panel of experts to discuss challenges and solutions concerning climate change and children's health. Please subscribe to the mailing list so that you can get up-to-date details on that event, as well as other events that are coming down the pike. And so you should have in the chat a link to register for those events and the newsletter. You will also receive a post-event survey that will pop up when the webinar ends. I really encourage you to complete it. We take very seriously your comments and suggestions. It helps us improve our events and bring new topics and speakers to you. So please do fill that out. And with that, I just wanted to appreciate all of you who have joined us, especially our panelists, and wish you all a wonderful week. So thank you.